Hi, this is Dr. Jason Dulac coming to you from my office in Springfield, Virginia. I get a lot of questions about cleanings. I want to go over some of those questions here with you today. What are the different types of cleanings? There's actually 9 different coding levels of cleanings according to the ADA. Most of us just think clean's a cleaning. And, if you come in, no matter what level of cleaning you need, we'll get the teeth clean, we'll get the gums healthy. The whole point of a cleaning or prophylaxis or a prophy is to keep the gums healthy, to keep you from getting gum disease. Gum disease is a multifactorial condition, much like cancer. It has to do with your environment, your home care, your brushing and flossing, and your frequency of cleanings, and also your genetic susceptibility to it. So if you go long enough without a cleaning, the majority of people will get some form of gum disease. We're trying to prevent that. If you do come in and you have some gum disease, we'll get that taken care of for you. We'll get you stable again. We'll get you back on track. A cleaning should not hurt. If it's painful, that means there's a lot of inflammation in the gum. We want you to be comfortable, but we want to get that junk out of there so they're healthy again. So we have topical numbing gels. I can give you full numbing. We have laughing gas, whatever you need to be comfortable. But we want to do a good job without hurting you and get the teeth clean so they can be healthy and you don't end up with any gum disease. Cleanings are recommended for most adults every 6 months. About a third of adults at some point in their life will, even at that regimen, will develop some form of gum disease or periodontal disease and will need to be seen more frequently. So at some point in your life, we recommend coming in every 4 months or every 3. Totally normal, happens to a lot of people. We're just trying to keep the gums healthy and prevent bone loss. So the gum inflammation will lead to bone loss if left unchecked. Once we lose the bone, we can't get it back. So cleanings are super critical, both for your comfort, the health, allow us to catch things early, but also once that tartar buildup, that hard stuff on your teeth. So, all that experience, we haven't brushed in a day or two like we should have, teeth feel fuzzy like they're wearing a sweater. That's plaque. That you can brush that off with your toothbrush. If you leave that on there long enough, a day or two, it'll start to calcify. So the same minerals in saliva that keep the teeth from dissolving, they'll start to deposit on the bacteria. And that forms the hard deposit that we call tartar or calculus. Once it's like that, you cannot get it off with a toothbrush or floss. It's got to be scraped off by the hygienist. So, and the more it builds up, eventually it'll go down under the gum and start to cause gum disease. So if you feel like you might be overdue for a cleaning, you probably are. If it's been more than 6 months, give us a call. We'll get you healthy. We'll get you back on track. It's one of those things, the sooner the better. The sooner you come in, the better off it's going to be. You should never feel self-conscious or concerned about coming into the office. That's what we're here for. That's what we like to do. Most hygienists will tell you it's very satisfying to get that stuff off the teeth. So we're probably a little weird and kooky like that. We enjoy doing that, but we really do. And we're here to help you and get you healthy. And if you should never hesitate to tell one of our staff that you're feeling more than you want to feel. If you have pain or discomfort, like I said, we'll get you numbing gels. We'll get you actually numbing. Both of my hygienists are trained in dental anesthesia. And we have laughing gas or nitrous oxide in the office. So there's no reason for you not to be comfortable. If you're someone who has chronic sensitivity, but you don't want to deal with, numbing at all, take the max dose of Tylenol and Motrin before you come into the office. Really takes the edge off. But we have a number of things to make you feel more comfortable. I got a blog on my website about tips for the anxious patient. But if you're having pain during a cleaning, that's a sign that the gums are inflamed. They're inflamed because there's too much on there. So we can help get you back on track with some better home care, some home products, and also get the teeth clean again for you with the hygienist. Cleanings range in length. I have patients that do an excellent job with their home care. They come in and it takes 10 or 20 minutes and the rest of the time is kind of shooting the breeze with the hygienist. So also we have some times that, someone hasn't been in 10 years and, we got to get them numb and get them comfortable and get all that stuff out. And that might take 90 minutes per half sometimes. So it really varies, but the important things, we want you to be comfortable and we want to get it all off the teeth for you. Cleaning cannot damage teeth at all. If something's coming off your teeth, it's tartar or it's something that was so badly broken that it was about to break on you anyway. So cleaning is never going to hurt the teeth. If you have tooth sensitivity, a lot of people have gum recession. The tooth is no longer covered by the gum or the enamel, like the top glassy part of the tooth or the gum. It exposes the root and the root sensitive. Very normal. I recommend over-the-counter desensitizing agents on a day-to-day basis, Sensodyne, things like that. I always recommend fluoride varnish after the cleanings. I have some root exposure. I have sensitive teeth myself. There are spots I ask the hygienist to skip with certain instruments, and that's not because the gums hurt at all. It's just that part of the root's very sensitive. So if you have a part of a root that's sensitive, let the hygienist know. We have 2 cleaning instruments. The hand scaling, a little rougher on the gum, but not sensitive on the tooth at all. The little vibrating water pick instrument, very, very soothing on the gum, but can cause some tooth sensitivity. So it just depends on the person, what's right for you. I always recommend both, but if you know something's going to bother you and you'd rather have them use one instrument than the other, just let our hygienist know. After the cleaning, like I said, the polishing should open up the root pores on the tooth, cause some sensitivity for people. I always recommend fluoride varnish after a cleaning. Some insurances cover it every cleaning, some insurances cover it once a year, some don't cover it for adults. It's $20 out of my office if it's not covered. I get it every time after I get my teeth cleaned. And it's not because I've ever had a cavity, it's because I have sensitivity. So the longer those roots are exposed, the more prone they are to decay. The fluoride varnish will really help protect them, help desensitize them, and help prevent cavities for your life. If you'd like to schedule a cleaning or know more about gum disease or your gum health, or you have concerns about your gum health, please give us a call at the office. It's 703-451-4500. DulacDES.com is our website, and we'd love to see you at the office today.